Hi, this is Joe. I'm here with Geoff, our patient. Geoff had 2 surgeries done actually. He had a right lateral epicondylar debridement, and he also had a revision right carpal tunnel release. So let me go into that a little bit. The lateral epicondylar debridement is he had something called tennis elbow. Dr. Cohen goes in there, cleans it out, and it's quite the procedure. It is a bigger joint. The biggest concern with that a lot of times is range of motion, getting strength back. It takes a little bit longer than some of the other surgeries. A revision carpal tunnel means that he redid somebody else's carpal tunnel. It's not the same as a basic regular carpal tunnel or a first-time carpal tunnel release because there's, you're having to go in, clean scar tissue. He does something called a flap. It's a whole procedure. Geoff is here. He's just a little bit over 30, he's 37 days post-op. He comes to us from Camarillo. He's an assistant lab manager. He's actually has a workers' comp, and he's here to give you his experience and show you how well he's doing, and give us his perspective on all this. Go ahead, Geoff.
Good morning. I was first diagnosed with carpal tunnel about 3 years ago, and through workers' comp, I had ultimately through failed therapy, and then I had surgery. And the surgery worked on my hand for maybe a year, and after a year, unfortunately, the numbness in the first 3 fingers came back. About the same time, I also developed pain in my outside of my right elbow, and I was referred through workers' comp to Dr. Cohen's office. I met him and his staff, who are fantastic, extremely focused on making the patient well. Had a great experience with them. Dr. Cohen decided to do revision surgery on my hand and the surgery on my right elbow. That was about just over a month ago. Almost immediately the numbness went away in my hand. It's almost completely gone. The surgery, I'm not sure if you can see, the scar is almost invisible. This is just the peeling back of the dead skin. And the same goes for this. The range of motion on my elbow is full. It's still sore at the actual site, but I have full range of motion, and so I'm healing amazingly quickly. So I'm very, very happy with it.
Great. Can we see your scar in your hand?
Certainly in the hand.
So that is 1 month out.
Yes.
Great.
And it's slightly tender to the touch, but not super painful, and the scar is virtually invisible.
Perfect. And that is revision, which
Correct.
is amazing. Well, thank you so much, Geoff. We're so happy that you're our patient, and we're happy to watch this journey with you getting better.
Thank you very much.